Welcome to our arm exercise video. When we've had persistent or long-term pain, we often reduce the amount of exercise or activity that we do and can become stiff and lose strength, causing a cycle that can actually lead to increased pain. Remember that movement is good for our bodies. Our joints and muscles are made to move. Movement and exercise can help our muscles stay strong and our joints flexible, and can also reduce your volume switch of pain. You may wish to choose just one exercise to begin with. Work out which level of exercise is right for you to start. In other words, try to find your baseline, the amount of exercise or repetitions that you can do that doesn't give you a flare-up of your symptoms. Start off small. It may be that you do 1 or 2 repetitions to begin with. Then as you gradually gain in confidence, you can start to build more. You can gradually increase the number of exercises that you do. Aim for your exercises to be sustainable. This will help you to avoid booming and busting. So try to avoid doing one big session in a week, because this might set you back for the next few days. If you notice an increase in your symptoms, you may need to decrease the number of exercises that you do, or go back to the easier level for a while until symptoms settle. Lisa and Steph are going to take us through a set of arm exercises today. These exercises are good for painful or stiff shoulders, helping with activities such as blow drying your hair or tucking your shirt in or reaching overhead. So let's get going. Lisa, to the left of your screen as you're looking at it, is showing us our first arm exercise, or the shoulder rolls. Steph has a bit more confidence and is able to do slightly bigger movements. This exercise is good for painful or stiff shoulders. Moving on to our second exercise, you can see Lisa is doing the exercise we call the pendulum in a seated position, letting her arm gently swing or sway forward and backwards, or you can go side to side or in a circle. Steph is standing leaning on a stable surface, allowing gravity to help her arm sway, again either forward and backwards, side to side or circles. The next exercise is useful if you struggle to lift your arm up or overhead. Lisa's only currently able to take her arm part way up, and she may assist this movement to begin with until she gets stronger over time. Steph has been working on this exercise for a while now and has gained confidence and increased her strength, and has progressed her exercises gradually so that she can now lift her arm higher. This exercise is a good exercise if you're struggling to reach behind your back, for instance tucking in your shirt or doing up your bra. To start with, Lisa was only able to get her hand to the side of her hip, but she can now get it to her bottom. With Steph, initially she had to assist this movement with her other hand. Steph again has been gradually increasing this exercise over time. Her arm has become more used to the movement and is more flexible and stronger, and she can now lift the arm higher. For our wall press up or worktop press up, which is a good exercise for general shoulder strength, Lisa needs to start a bit closer to the wall or worktop, which makes it slightly less challenging. Steph can start her exercise further from the worktop. Aim to keep your body in a straight line with this exercise. This exercise is the last exercise in our arm and shoulder series. Lisa starts sitting in a chair, pushes herself up gently like she's about to stand up from the chair to feel her arms working a little. Steph has progressed now with this exercise and she has been gradually building up. She can now push herself up off the chair to help strengthen her arms and shoulders.